Hello, I'm Jerry Taylor, the co-chair of the ACHA COVID-19 Task Force and former Associate Dean and Director of the Health Center at Bentley University in Waltham, Massachusetts. Today, we're discussing COVID-19 Task Force's updated guidelines for fall of 2022. I'm thrilled to have with me today Dr. Cheryl Hug-English, a member of our task force and director of the Health Center at University of Nevada, Reno. She wrote the guidelines on testing. Cheryl, thank you so much for joining us today. Would you go over the three most important key points from the guidelines on testing?
Thank you, Jerry, and I'm really happy to be with all of you today. I don't think any of us realized that 2.5 years later, we would still be dealing with COVID-19. But it has not gone away. And I think it's still important that we consider guidelines and particularly with respect to testing. Testing remains an important tool, a very important tool in helping us to identify infections caused by SARS-CoV-2 virus. Diagnostic testing should be done on anyone who's experiencing symptoms of COVID-19. And that includes people that are vaccinated or unvaccinated, and those that have had previous infections from COVID-19. As we've seen, immunity, both from natural causes as well as vaccination, has waned over time. So it's important to consider that anyone with symptoms should be tested. Diagnostic testing is also important for those who've had an exposure to someone diagnosed with COVID-19. For those people, it's important not to do that immediately because that test it will be too soon to pick up the infection, but really on or around day 5, unless symptoms develop. And if symptoms occur, definitely test when those symptoms develop. One of the things that I think has been hugely helpful is the increased availability of home test kits. Those antigen test kits have increased access to testing across our nation. And for anyone who doesn't know, simply by going to the website that I've included on the resource page, anyone can get free test kits from the federal government simply by requesting them by email to be sent to your home address. So that has been a huge increase in our availability of testing. The second factor that I really want to talk about is that approaches to testing are really dependent on many factors. And some of those include, what are your community case numbers? What are your campus case numbers? What is the rate of hospitalization in your community? What's the level of vaccination rate on your campuses? What are your testing resources? And finally, what are your state and local guidelines like? That is different across our nation. Each of our wonderful campuses are unique and special, but the resources and levels of transmission and infection can also be very, very different. So in addition to diagnostic testing, campuses really need to determine the importance or need for surveillance or screening testing. And some of those considerations are given to factors like community spread, campus levels of infection, and vaccination rate. Some things to consider might be pre-arrival testing for those that are moving into campus housing, or if you have a big orientation week where all of your freshmen are gathered together, you may want to consider pre-arrival testing before that orientation week, or perhaps pre-arrival testing for those who are unvaccinated. These are just some considerations, again, for individual campuses. The third point that I want to make is that the CDC has come out with what I consider to be a great addition to assessing our risk. And this community resource determines risk levels based not only on numbers of infection, but also looking at hospitalization rates in your community, as well as number of beds that are occupied by people with COVID-19 infections. Those three factors in combination combine to create a risk profile that the CDC has put out and made available to all of us that we simply can put in our county and get a risk level for our community. It can be low, medium, or high based on those factors. This is a helpful tool for our campuses in helping determine what mitigation strategies we may want to employ. It's also helpful for you to be able to take to your administration to let them know what is happening in our community. And again, that website is included on the resource page. One final thing that I do want to mention that I think is an additional important kind of community assessment is wastewater surveillance. And this can help us to evaluate community trends of infection level and can complement some of the other surveillance strategies that are in place. It can also assist our health districts in determining community risk profiles. It can help us provide surveillance when levels of testing are limited. And it is an early indicator and can be seen 1 to 2 weeks before we begin to see positive test results. It does have some limitations, however. It can't determine individuals who are positive and have tested positive, and may not be accurate when the levels of infection are incredibly low, and it can be expensive. With that, I will end and say again that I think testing and surveillance measures are an important strategy for us to continue to combat the spread of COVID-19.
Thank you so much, Cheryl, for sharing your expertise and this valuable perspective with our audience today. And many thanks to our audience for watching this video. If you have not accessed the updated ACHA guidelines, you can find these and other tools at the link shown on the slide. If you have any specific questions about COVID, go to contact@acha.org. And to join the discussion about this and any other COVID-related issues, go to ACHA Connect. Thanks so much for joining us today.